Good morning. I always get the tough act of following the secretary, but I will do my best. Last night, we officially launched the Virginia Center for Health Innovation. That's particularly exciting because a year ago at this conference, I believe the secretary told you we were going to put together a Virginia Center for Health Innovation. So we had a deadline to come back and show you that we weren't just planning, that there was real action involved. The mission of the center is to work in partnership with multiple stakeholders to accelerate the adoption of value-driven healthcare and wellness in the Commonwealth of Virginia. Multiple stakeholders. That is the real core behind the Center for Health Innovation. You will see, and I'll show you in some future slides, that the employer community, the physician community, the hospital community, the pharmaceutical industry, the health plans, consumers are all engaged in getting the Center for Health Innovation off the ground. Bottom line is that we've got to have all those stakeholders at the table having the tough conversations. The work of the center is not going to be easy, but it's essential to getting us to move forward with some benchmark research and demonstration research. How will we add value to Virginia? One of the most important things that we've discovered is that there is innovation going on throughout the country. Later today, you're going to hear a whole host of examples. But right now, you would be hard-pressed, I think, to be able to go to one place in Virginia and figure out what's working in other places that would be really good to bring here to Virginia, and can we do it in Virginia? And so one of the goals of the center is to be that one-stop shop where you can find out what's happening throughout the Commonwealth, what's happening throughout the country, throughout the world that might be applicable. Then when we look at these other models and we see what's working, how do we get them going in Virginia? We need an organization, and the center will serve this role of bringing all the interested parties together, getting them to agree to participate, kind of laying out the terms of participation, and getting the demonstration projects moving. One of the most important and exciting things about the Secretary's involvement as our chair is that the state is committed to engaging with state employees, with the Medicaid program. We've not asked the state for dollars to get the center going. We need their engagement. We need the engagement of the employer community. That's why today is so exciting to see so many of you here interested to participate, because the truth is we need numbers. If we're going to change the system, we need people engaged, asking questions, willing to run demonstration projects, willing to be evaluated, and then spreading the information. The third piece of the center's role is really to convene and educate stakeholders. One of the things that I found about a year ago when I first started talking to employers was that employers were pretty much in agreement that they were tired of the high premiums they were paying. But then they really didn't know what else was expected of them to change that dynamic. And so part of the dialogue with this group especially is, how do we come together and give you action plans? How can you start getting the things that you need to guide us to value-driven healthcare? And we want to give you that. And then the final thing is the spread. One of the most frustrating things probably that I've seen in the last year of my journey to this point is that there's some amazing things happening in the Commonwealth and nobody knows about them. The information is not readily accessible. I'd go out and people would tell me about a pilot that they're running, but there's maybe not any outside evaluation of that pilot. There's just kind of their word that it's working really well. There's no effort to get that information in the hands of other folks who might want to replicate it. So that's another essential piece. We have to do a better job of spread. So the goal is simple. We have to achieve a competitive edge for Virginia. As the Secretary said, healthcare is a huge piece of the economy. We are competing against other states to bring jobs to Virginia. And economic development firms are now telling us that they are looking at the health of the local population when choosing a region. They are looking at the cost of providing care. And if we don't do a better job, you will see jobs leave Virginia. You will see companies not choose to locate here. And I think you're going to hear a little bit more about that later today as well. We don't intend to duplicate the work of any of the existing organizations. In fact, we have a staff of 2. So our goal really will be to contract with those who have the expertise in the Commonwealth to deliver these demonstration projects. How are we organized? And I know this is a little hard to see. The center is a 501c3 nonprofit organization. We have a board of directors that guides us. We also have 2 advisory groups. We put together a demonstration project advisory group. This is the group that I think of as my policy wonk team. These are the people that really know when you start talking about payment reform or patient-centered medical homes or value-based insurance design. These are the top-notch people in the field that can help us put together demonstration projects, can help us do the RFPs, evaluate the projects. Then we have the second advisory group, which is what we're calling the Health Innovation Advisory Group. That's a group that can help us with the spread strategy. How do we get the information out there effectively to all our stakeholder groups? Structure. We were officially incorporated in January. We have submitted all our paperwork to the IRS and are waiting to hear back on our nonprofit status. We are very fortunate, and I want to extend a thank you to both Barry and Ned, that the Virginia Chamber of Commerce has agreed to house the center. That is essential in our working with the employer community that Bob Kramer is going to talk to you a little bit about later today. The Virginia Hospital and Education Research Foundation has agreed to serve as our fiscal agent while we're waiting on our tax-exempt status. That means that anyone in this room can give money to us if they'd like to, so we're open for business there. We're also fortunate that Richard Greer, who some of you may know is an attorney with Thompson McMullen, he has provided all our legal services as a pro bono contribution. We've raised $385,000 in startup funding, and I want to take just a minute and mention those partners that put up $50,000 each in seed funding. The Medical Society of Virginia, Pharma, the Virginia Association of Health Plans, the Virginia Healthcare Foundation, the Virginia Hospital and Healthcare Association, and Virginians Improving Patient Care and Safety. We've got to get a round of applause for those groups. And then we've also already received 4 grants. We've received grants from Pfizer, Merck, the Healthcare Foundation, and Grant Makers in Health, which is pretty good considering we've been open since January. The board, and I know this is really hard to see, but I put it up here just so you get a sense that it truly is a multi-stakeholder, high-powered group, chaired by the secretary, our other officers, Nancy Agee, the head of Carilion Clinic, is our treasurer, Barry Duvall is our secretary, and then you'll see it flows from there. Employers, hospitals, physicians, all are at the table. One of the important things for you as the business community today to recognize is that a majority of our board is from the business community. The next big test is really to establish our values and metrics. Before we get running on programs, and everyone is eager to get the programs going, we really have to determine how are we going to look back a year from now when I come and talk to you and tell you if we've been successful. What will success look like? And so the board has been working very hard. At our April meeting, they determined their set of values. And right now we're working on a set of metrics to gauge how do we get the highest return on our investment, where are the areas where we can leverage other funds most successfully, and where can we make the biggest impact on improving value in healthcare. We have agreed on a first project that we've already started the development of, and this is the Virginia Health Innovation Network. The idea behind the network goes back to the spread strategy for our work. We need the one-stop shop where everyone can go and find out the latest, greatest information on health innovation in the Commonwealth, whether it is tools and resources that they need, information on patient-centered medical homes, information on value-based benefit design, whether it is more of a social network piece that will also be there so that, for example, large employers could have conversations among themselves about, we've tried this prevention and wellness program, has anyone else done anything similar, what have your results been, how do we gauge that, whether it's launching innovation challenges. One of the things that we've seen that's been very successful is to kind of put out an RFP for an application, for example, that is needed, and letting college students, small entrepreneurs compete to see who can come up with the best application. We need to have a one-stop shop for that type of information. So the network development is underway. We anticipate that by the conference next year, we will be able to walk you through participation in the network. I look forward to working with all of you, and if you have any questions, I'm happy to talk with you. I'll be here all day. Thank you very much.